Everyone, Jeff here, and today we're going to talk about something slightly controversial. Now, for the past 20 to 25 years, we've been told don't go out in the summer sun unprotected. Make sure you slather on the SPF 30, SPF 40, SPF 50. And what I'm going to tell you is, as a result of this, most Americans, not all, but most, are vitamin D deficient. Where do we get most of our vitamin D? From unprotected sun exposure, all right? What if I told you, I've told you several videos that fat does not cause heart disease. Well, what if I told you unprotected sun exposure may not cause melanoma? In fact, all the evidence points to just the opposite, that if you don't get unprotected sun exposure, you will develop melanoma. How about that? So what we want to talk about today is getting safe, basically safe, unprotected sun exposure. Now, and it's the key is to do it safely, right? Am I telling you to go out and get sunburned? No, right? That is the worst thing you can do. However, you need to slowly implement a sun exposure plan. For instance, all right, my wife, very fair complected, right? She needs to slowly start getting out in the sun. Maybe first week, 3 times a week, maybe for 5 minutes. Just as much bare skin as she can show, basically without any kind of sunscreen, all right? And then if she's going to stay out in the sun any longer than that, put on the sunscreen, all right? However, you want to give yourself some exposure. After she does that for 5 minutes, 2 or 3 days a week, then she may want to increase the exposure to 7 to 10 minutes, all right? And eventually, because she is lighter complected, she may only need about 15 to 20 minutes 3 to 4 times a week, all right? However, if you have darker skin, all right, or if you tan easily, all right, then you may need more sun exposure. If you're African American, you're going to need up to at least 30 minutes of unexposed, when I say unexposed, unprotected sun exposure to get adequate vitamin D 3 to 4 times a week, all right? So with that said, let's just talk about a few things here, right? First of all, like I said, everyone needs safe, unprotected sun exposure. And like I said earlier, you want to slowly increase the amount of sun you get. And like I said, if you're going to be out in the sun 3 or 4 hours, by all means, put on the sunscreen. However, like I said, you need to get some of that sun soaked up as much as you can with as much skin as you can, all right? Now, why is this, all right? Now, if you look, vitamin D in your health, and these are all studies, all right? And most of these are not just one study. We're talking about multiple studies, all right? Studies I found, it shows it prevents sun exposure and vitamin D increases will prevent some breast cancers, prevents a lot of colorectal cancers. In fact, they basically were saying somewhere around 660,000 cases of breast cancer and colorectal cancer could be prevented a year just by more sun exposure, higher vitamin D levels, all right? Number 3, could prevent up to 16 different types of cancer. When you start looking at cancer research, vitamin D comes to the top. And when I say vitamin D deficiencies. All right? And once again, it goes back to not getting enough sunlight. Now, next thing, 60% of people with type 2 diabetes have a vitamin D deficiency. Now, did you guys see that? 60%. Vitamin D deficiencies linked to autoimmune disease. In fact, some of the literature I read said if you have rheumatoid arthritis and your doctor is not looking at vitamin D levels, they're actually doing you a disservice, all right? Bottom line is vitamin D plays a crucial role in basically preventing and in helping overcome autoimmune problems. Vitamin D deficiency, there's a strong link to heart disease and stroke. And we're going to talk even more about that in a later session. And then also, new research finding that vitamin D deficiencies linked to dementia. All right. So, with that said, all right, once again, we're not promoting sunburns here. All right, that's not what I'm doing. However, you need to get out in the sun. You need to lose the sunscreen. Slowly increase your time in the sun, and show as much skin as you can, without being arrested. All right. So, with that said, like I said, hopefully today you start your sun exposure. Like I said, 5 minutes. All right. If you're gonna be out longer, like I said, get some sunscreen on. But we're gonna talk more about the different types of skin cancer. There are 2 types of skin cancer that are rather benign, but they are directly linked to unprotected sun exposure. However, the big one, melanoma, if you start really reading and doing your research on it, if you don't get unprotected sun exposure, your risk for melanoma may actually go up as a result. Think about that. All right? We're going to talk more about this because this is an important health thing. And like I said, if you got comments or questions, leave them in the comments below. We'll see you in a day or two.